Hi, I'm Ashley Chauvin and I'm a naturopathic doctor. I commonly see patients with a diagnosis or history of breast cancer in my practice. Currently, there are more than 3 million women who have been diagnosed with breast cancer in the US. The average 5-year survival rate for women with invasive breast cancer is 90%, and the 10-year survival rate is 83%. It doesn't come as a surprise that some of these survivors come into my office with questions about supplements or diet. Today I'm going to discuss some nutritional interventions to reduce the risk of breast cancer and to reduce the risk of recurrence. The first thing I'm going to speak about today is intermittent fasting. Intermittent fasting is a very hot topic right now, especially with respect to weight management as well as blood sugar control. There was a study done with breast cancer survivors looking at the impact of fasting, and the study showed that patients fasting for 13 hours overnight reduce the risk of recurrence. So in my practice, I encourage patients to fast for 13 hours overnight with hydration, which means that I encourage them to drink water, or they can have black coffee when they wake up in the morning, or black tea. Really, for a lot of my patients, this reduces mindless snacking after dinner or, a late night snack before bed. The next thing that I want to speak about is alcohol. Alcohol is a known carcinogen, and therefore I encourage all of my patients to avoid it. Alcohol can increase inflammation and disrupt blood sugar control. Some of my patients would prefer to limit it rather than to completely forgo it, and that's their choice. In those patients' case, I do remind them of the study that came out where they looked at patients that did consume alcohol after breast cancer, and it showed that patients who drank 3 drinks per week or even half a drink per day actually did have a higher risk of recurrence when they were postmenopausal. So therefore, I just have patients keep that in mind, and I also encourage my patients to try non-alcoholic beverages such as coconut water, or there has been some companies that have come out with some really tasty non-alcoholic wines or beers, and a lot of them have less sugar as well. Another thing that patients can try that's relatively inexpensive, and you can find it at the grocery store or bulk food store, is flaxseed. Flaxseed is a source of fiber as well as a phytoestrogen. No human level data has been shown to have interactions between flaxseed and selective estrogen receptor modulators such as tamoxifen or aromatase inhibitors. That's been a concern with a lot of my patients. And in fact, flaxseed in combination with tamoxifen appears to reduce tumor size by a greater margin than with tamoxifen treatment alone. Current evidence suggests that flax consumption may decrease the risk of breast cancer development and may exhibit anti-tumoral effects in women when their consumption level is 25 grams of ground flaxseed per day. 25 grams of ground flaxseed per day roughly translates to 3 tablespoons of ground flax per day. A common question that I get from women is they are concerned about if they need to grind up the flax seeds fresh or if they can buy them ground already. And in those patients, I say you don't need to grind them fresh every day. Imperfect action is completely okay. Myself, I buy flax seeds pre-ground and keep them in the freezer. The last thing that I want to talk about today is soy. Soy has been a hot topic in my practice since I began practicing in 2012, and while I went to radiation therapy school much earlier on than them. I get questions about soy frequently, at least every week. And a lot of patients are wondering because, especially for patients who want to employ meatless Mondays, a more plant-based approach, and they're looking for extra sources of protein, soy is a source of plant-based protein. I remind all patients that the source of soy is important, but when it comes to breast cancer recurrence, there's actually been this study quite a bit because it's such a hot topic. And what it comes down to is soy is completely fine for you. It's actually been shown to reduce mortality and recurrence in breast cancer survivors. And this has been extensively studied. In fact, it's been shown to reduce the recurrence and mortality in both estrogen positive cancers and estrogen negative cancers. That's important because soy is a phytoestrogen, and I think that's where a lot of the controversy comes from. It's also important to know that these studies also looked at premenopausal women and postmenopausal women, and the same thing came out. Soy was definitely safe and helpful in both of those cases. So hopefully this encourages you to add a little bit of soy milk or tofu into your diet and not be afraid of this plant-based protein. I hope you enjoyed hearing about some of these nutritional interventions today. Please let me know in the comment section if you have any questions. Stay well. Bye.